At the Children and Youth in Challenging Contexts Network, we collect and share best practices for improving the mental health and well-being of vulnerable young people, including those who have been exposed to violence. Young people who are exposed to violence are at a higher risk for conditions like depression, anxiety, and post-traumatic stress disorder. Some young people live in challenging contexts, and this makes them vulnerable to even more layers of violence and marginalization. Challenging contexts could include being affected by war, living in alternative care or detention, coping with poverty, or other types of marginalization. There is a range of interventions that can be used to help young people who have been exposed to violence. These interventions fall into one or more of three categories: mental health promotion, mental illness prevention, and treatment of mental illness. Whenever possible, the CYCC suggests an integrated approach that combines all three. Mental health promotion is about nurturing resilience by building on the strengths that already exist in children, youth, and the communities they live in. This is known as a strength-based approach. When the people working with youth ensure the services and resources they provide are culturally relevant, they can provide better support, which lowers the risks associated with violence for young people. For example, in Sierra Leone, youth workers with the Red Cross help war-affected young people through counseling and teaching relevant skills, like carpentry and cloth weaving. This is a strengths-based approach. Programs that prevent mental illness focus on building awareness of the effects of violence and changing an individual's behavior. These programs empower young people to ask for the help they need and give them coping and problem-solving strategies. In Halifax, Canada, family counseling offers youth at risk of joining gangs the tools they need to strengthen the relationships they have with their family and peers. This approach can be applied to many different populations and contexts. A program in Chicago uses this approach with refugee youth, providing them with culturally sensitive, community-based education and support groups. This helps them develop meaningful relationships with family and community members and helps create stronger, positive relationships to rely on. Mental illness treatment programs are necessary for children and youth who have experienced or witnessed violence and later develop mental health issues. Trauma-specific cognitive behavioral therapy, CBT, focuses on helping the young person lower their emotional distress by challenging and changing their patterns of thinking and beliefs in one-on-one, family, or group therapy sessions. Cognitive behavioral therapy is often used with arts-based therapies to help youth express themselves about serious issues in creative ways. Other unique approaches, like equine therapy, use the therapeutic effect of connecting with horses to help young people recover from trauma. Service providers need to develop solutions that integrate mental health promotion, mental illness prevention, and treatment for mental illness. Through collaboration with diverse partners, including the young people who have been affected, their families, and their communities, we can make the biggest impact. What do you see working well with children and youth affected by violence? Email us to let us know. We will update our best practices database and documents. You can find the full report and policy document on our website.